Hi, my name is Paris Houston, and for the CEC, I'm going to be focusing on a shoulder impingement. So my client happens to be a swimmer, and right now they are suffering from an upper extremity injury, which is that left shoulder impingement. This basically just happened due to overuse and dysfunctional movement patterns throughout swimming, which eventually led to this complication. We have weakness in the left rotator cuff, so the supraspinatus, subscapularis, infraspinatus, and teres minor are being affected right now, as well as the coracoacromial ligament, which is the most important ligament when it comes to a shoulder impingement. As you can see from our postural assessment, we looked at her laterally, anteriorly, and posteriorly. What we were looking for, which was found, was thoracic kyphosis, which is basically an excessive rounding of the back, and this affects scapulohumeral function, so it affects the joint mostly. And then we do see a forward head lean. This is caused by tight upper traps as well as a tight levator scapula. And then we see forward shoulders, which are caused by weak lower traps and tight upper traps. So basically we can see that the upper traps are compensating for a lot right now when it comes to the shoulder impingement. For overactive muscles, we're going to be looking at the upper trapezium, aka upper traps, pectoralis minor, and sometimes major depending on the severity of the case, levator scap, lats, as well as deltoids, mainly anterior deltoids. However, some posterior deltoids are involved in this complication, or I shouldn't say complication, but in this injury. And then we're going to look at the subscapularis because this helps with medial rotation, which is within that rotator cuff, and we're having problems there. These muscles are what pull the shoulder forward and upward and help with medial/internal rotation, jamming the joint space and making overhead or even reaching movements painful for said client in her left shoulder. For underactive muscles, we have the striatus anterior. So sorry, I do not know if I'm saying that right. We also have the rhomboids. We have lower trapezium, lower traps, the deep cervical flexors, which can be found within your neck, and then infraspinatus, which is known to help with lateral rotation, so external rotation, and then teres minor, which also does the same thing, helps with that rotation. These muscles are the main stabilizers of the shoulder, so these being poor at the moment lead to poor movement, and then the poor movement leads to the narrowing of the subacromial space, which leads to the shoulder impingement. And then basically I have the CEC of what we're going to go through for the video. So we're going to start with the inhibition, lengthening, activation, and integration. And that will be shown later within the YouTube video. And then we have my references. So thank you.
Today for my inhibitory techniques, I'm going to be demonstrating two self-myofascial releases, aka SMR stretching. So for the first one, we're going to focus on working on that overactive trap since my client does have a shoulder impingement on the left side. And today we're going to be using a golf ball. You can use a tennis ball or a foam ball, anything to help. But basically we're going to work on hitting that upper trap, and you can kind of think of it as a triangle in your back. That's where the trap resides, but we want to focus on this upper portion. So we're going to grab the ball, lean it to a side of the wall, and you can either hold it right here, or you can move your arm up and down to get an active stretch. And then the client's going to be doing this for about 30 seconds or 10 reps if we do it with the active stretch. And now basically I'm going to have my client perform it with the left shoulder impingement. So you're going to place it on that triangle right about here, and then you can lean into the wall, dropping your shoulder. That'll help you get a better angle on the trap itself. There we go, perfect, and just push into the wall. There we go, and then to do it actively, yeah, you can just move your arm up and down. Like that. Yeah. For the next next inhibitory technique, we're going to do a pec minor stretch, but we're going to do a deep stretch involving a golf ball just to get into that tender pec minor. And the way to find that, since this is an overactive muscle, it's going to be right underneath your collarbone, and you're going to feel the tenseness just because it has been overactive for the shoulder impingement. Once again, we're going to work on the left hand side of the body. We're going to grab the golf ball, place it right above or right on our pec minor, which, like we said, is under the collarbone, about 2 inches down. You're going to place the tension on it. And now this is a good technique. You can either hold it, however, to add a progression, we find that active movement feels better. So you're going to grab your left hand up, and you're going to pretend like you're doing a shoulder press. And just have that against there. And you're going to do this for about 30 seconds, or 10 reps. And so now I'll be having the client perform it. And basically the tip I gave her to find the muscle is just to create an L under your collarbone. And then once you get to that spot, you'll feel it. So here you go. And the purpose behind these two inhibitory techniques are basically just to relax the overactive muscles that are compensating and releasing that compression on the rotator cuff itself. Perfect, and then you just go up, down.
I feel that.
Yeah, and like a shoulder press motion. Make sure to do it for 30 seconds, or like I said, 10 reps. Now for the lengthening portion of the CEC, we're going to focus on doing a doorway stretch for the pec minor. Like we stated earlier, this is overactive, so we just want to try to work on decreasing that and just making sure that it gets lengthened so that way it is not overactive anymore. So basically you want to find a doorway that you can fit both arms in, and you're going to have about a 90-degree angle, having your arms up like an L. You're going to put one foot in front of the other, just so that way you have stability at the bottom and this does not affect your lower back. You're going to place both hands in the doorway, and you're just going to go forward until you hit that nice tender spot where you feel the pec minor stretching out. You're going to hold this for about 30 seconds. And then this will basically just help improve range of motion and, like we said, deactivate that overactive pec minors. And now my client's going to run through it. So basically, like I said, we're going to want to have our hands up about 90 degrees each way, and we want to reach them out to be in the doorway. Okay, perfect. And then step one foot in front of the other to create that stability. And then basically you're just going to lean forward and get those pec minors stretched out. And you're going to hold this for about 30 seconds. Now for the second lengthening technique, we're going to work on the upper trap, and we're going to focus on that area. So like I said, left shoulder impingement, left hand side. We're going to sit down. You're going to grab the bottom of the chair, making sure to hook it so it drops that shoulder so you can get a nice deep stretch. We're going to tilt our head to the right, and we're going to use our right hand to go ahead and get a nice pull. And then the client's going to hold this for about 30 seconds, just making sure to go ahead and get a release. Now I'm going to be walking my client through it. So like I said, we're going to go ahead and use the left hand, just drop it down and hook it underneath the chair to get a nice deep pull on the shoulder. Tilt your head to the right, and then use your right hand to go ahead and grab your head and just pull it that much deeper. And then you're going to hold this for about 30 seconds. And we just do these to increase range of motion as well as to lengthen the overactive muscles themselves, like stated earlier. Now for the activation stage of the CEC, we're going to be doing some prone Y raises. This is just going to help target the lower traps as they're an underactive muscle when it does come to the shoulder impingement. So we're just going to get on the ground, and we're going to go ahead and put our hands out and create a nice 45-degree angle. And then we're simply just going to raise them up, making sure to keep our shoulders tight and to squeeze our back, as well as making sure that our pelvis is on the floor to engage the core so that way we hit those stabilizers. And the client's just going to do about 15 of these, just to go ahead and, like we said, to work that underactive muscle and to get it to the state it needs to be in. Now I'm gonna have my client perform it. So if you just wanna go ahead and lay out, making sure that you just keep your head down, not raise it. Mine was raised because I was doing the demonstration earlier. And then go ahead and stick your arms out. You're gonna wanna have them at a 45-degree angle, perfect. And then simply just go ahead and squeeze your back when you raise your arms. Nice. And then go down and come up. And you're gonna do this about 15 times. And it's good that she's keeping the upper portion of her chest off the ground right now. For the second part of our activation, we're going to be doing some scapular wall retractions. Basically, what we're going to do is we're going to lean against the wall. We're going to make sure our back is not rounded, so we're going to push our backs onto the wall, making sure to engage our core. We're simply going to raise our arms, start right here about head height, and then we're simply going to press up, making sure that we keep our hands against the wall, going nice and slow, and making sure that we're aware of our scaps, and just basically feeling them doing the movement. And then once you go to the highest range of motion that you can, depending on your severity, you're just gonna come down, nice and slow, making sure to keep everything tight and aligned. And then the client's gonna do these for, once again, 15 reps, just making sure that they focus on what they need to focus on to improve that range of motion and to go ahead and get that underactive muscle active again. Okay, so now I'm going to go ahead and have my client run through it. And so, like I said, make sure that your back is pushed against the wall. Great, and then go ahead and put your hands your hands head height, and then simply make sure that your fingertips are against the wall and just press up. Going slow, nice and controlled in the range of motion. And then you just come down. Nice. And you're going to do this for about 15 minutes. Now for the integrated dynamic movement part, we're going to do some resistant band shoulder presses. And basically this is going to help go ahead and activate those anterior delts as well as the traps, just to get any correction on that scapular winging that you might see within a shoulder impingement. So we're going to put the resistance band, and you can do whatever resistance that you're able to handle at the time, coming into the condition. And then a way to go ahead and add a progression is to move up in resistance bands themselves. So we're just gonna open up, and we're gonna put our hands about shoulder width apart, and then we're just gonna come up, and then we're gonna press like you would do a normal shoulder press. Making sure to really squeeze our backs when we go on the way up and to focus on coming down stable on the way down. And then we're going to do this for 15 reps. Okay, and now go ahead and just like I said, put your arms about, shoulders width apart. Go ahead and up like you're fixing to do a shoulder press, and then press up, and then come down, and that'll be one. We're going to do this 15 times. For the second exercise, we're going to go ahead and do band pull apart. So it's once again a resistance band. Like we said, as progression, you could just go up on the intensity of the resistance. And these pull aparts are going to focus on the rhomboids as well as the traps as well as the posterior delts. So once again, we're just going to put these around our wrist. Go ahead and be shoulder width apart, and we're simply just going to pull out, making sure to keep our elbows tucked in and don't let them flare out, making sure that we squeeze our back, and then we're just going to simply come right back in. And we're going to do this one also for about 15 reps. Now I'm going to have my client do it. So she's just going to go ahead and make sure that you open up nice and tight, keep those shoulders tucked. Nice. And then we're going to do this for 15 reps.